This is Sarnia Lambton Daily for Friday, May 29th. Good evening, I'm Terry Doyle. A dramatic move is being made to help stem the tide of COVID-19 in a Sarnia nursing home. All COVID-19 patients at Vision Nursing Home are being moved to Blue Water Health. There were 9 active cases of the virus in the home among residents. Overall, 24 had tested positive since the pandemic began, with 7 deaths. 8 of the residents are considered to be recovered from the virus. There have also been 24 staff tests positive at Vision. 16 of those are still active. By relocating the residents and COVID-19 positive staff already off-site, the plan would see the virus removed from the home. Lambton Public Health will still keep the outbreak status in place. A home comes out of outbreak when there have been no new cases for 2 weeks. Meanwhile, the outbreak has ended at 2 Sarnia homes. Marshall Gowland Manor had 1 staff member test positive for the virus, and the outbreak was declared on May 15th. At Vision on the St. Clair, 2 residents had COVID-19 tests come back positive, also having an outbreak declared on May 15th. There have been no further positive cases at either home, and the outbreaks have been declared over. The remaining outbreaks in the region are at Vision Nursing Home and Lambton Meadowview Villa in Petrolia. The overall numbers in Sarnia Lambton show that there have been no new positive cases in the past 24 hours, leaving the number at 261 with 22 deaths. The number of people recovered jumped by 6 to 196. That drops the total number of active cases in the community to 43. Beginning Saturday, drive-through testing for COVID-19 will be available in Sarnia Lambton. In Sarnia, the Twin Bridges Clinic on Front Street will be open for drive-through testing. It begins Saturday from 9 a.m. to 2 p.m. You must approach from the south so you can make a right turn into the parking lot. The Petrolia Clinic is still asking people to make appointments. To get tested, you must have your Ontario health card. Well, it's Friday. As we usually do on Fridays, we check in with Sarnia Lambton MPP Bob Bailey. And Bob, right off the bat, let's touch on the topic of the week when it comes to the province and everywhere else. And that was the report that the Premier released earlier in the week about the military going into the 5 homes in Ontario and seeing some pretty troubling results. And that has certainly opened things up. And I'm sure you and your colleagues have had a lot of discussions on that it has been a busy week, certainly wanting to get to the bottom of this.
Yes, and thanks for your TV and your work, Terry, and staying on top of these issues for the Sarnia Lambton community, and certainly keeping people fully informed. Yeah, that report that came out, I was certainly shocked myself. I know the Premier and all of my colleagues were as well. I mean, we've had concerns over the years, different levels of government, different governments, different parties that have been in charge. And I think this COVID-19 just exacerbated that with, everything from the inspectors, unable to go into the homes. There's some controversy over that, discussions back and forth about whether they could go in or they wouldn't go in. I'll leave that to be resolved further. But I think the Army going in focused certainly, first of all, they went in, excuse me, because there was a shortage of help. Because a number of people got sick, hundreds of, I assume, staff in those 5 to 7 homes. We haven't really settled on the numbers. I know it's a minimum of 5 in the Toronto area, but I'm sure there's at least 2 or 3 more. And so, with a shortage of staff off sick, off with the COVID themselves, and then of course those people were trying to manage. So the armed forces going in there. Thank God we had the armed forces. I want to give credit to the armed forces that were able to step in and help at that time. So these issues have been highlighted. The Premier's committed to a full inquiry to find out. He's offered to testify himself. I see other former leaders, former ministers of health from other governments have said they'll testify if called. They want to get, what they knew, what they seen in the workplaces, in these residences on the record as well. So I'm looking forward to that, and we need to clean this up for once and for all. It's where people that have, built this country, built this province are going, and our seniors should be able to live there, in decency and with health. Their families need to be reassured that their loved ones are being looked after properly. Even locally, we have nine residents from a local long-term care home, Vision. Earlier today, were transferred to Blue Water Health because they've come down with COVID-19 at Vision. They've got a number of staff off with COVID themselves. They were run off their feet. Blue Water Health, I'm glad to say we have Blue Water Health under Mike Lepine's leadership doing an excellent job here. Mike and his team have moved in. They have at least, last count I heard, at least 15 of their everything from nurses to infection control to cleaning staff that are in there working with Vision. I like to say working with, they're not taking over the home, but they are in there to help and to provide any assistance they can. We've moved those nine residents of Vision to Blue Water Health. They're going to be in a COVID-19 unit there where they'll be isolated there with all the proper care, feeding, everything. They'll get that proper care there, and I'm looking forward to those 9 people, within a week or two, hopefully being recovered, and then we'll have to look at how we bring them back to Vision, where they will want to go, I'm sure. So that, I'm glad that we have that. I'm glad to talk about that. My office had a number of inquiries about the Canadian military report, and I look forward, as well as the Premier, to this inquiry, to this commission, and getting to the bottom of this.
I know we've heard, and we had saw guests on earlier this week, that this is something that's been going on for a while, not just a report that came out on Tuesday. And do you believe one of the challenges might be the for-profit versus not-for-profit, public versus private, could be something that people are really going to have to look deep into?
Well, I think some people are trying to make that argument, but I can personally say that here in Sarnia Lambton, I know a number of, they're for-profit. They're not run by the county. There are a number of for-profit homes, and knock on wood, they've had no instances yet, but they've been very strict about their protocols. They locked down early on, refused to allow their employees to work at different homes. They had to, even before the province told them to. So those 2 homes that I know of, there's 2 I know of that are private, and they've had, like I say, to date, no outbreaks. Now we've had some county-led homes, municipal homes, for one of another, an easier way to describe it, that have had outbreaks, and some for-profit residents that have had outbreaks as well. So I think it's a combination. I think it all depends. I think if you have to have the right people in charge, and like I say, those homes in the county that I'm speaking of, and I'm sure others in Sarnia, clamped down early on, and they made sure that there was none of this transferring from somebody working 4 hours at one home and then getting another 4 hours somewhere else, or going to people's homes as well. So that's something we're going to have to look at. We're going to have to look at the pay. We see what's going on in Quebec. The Premier down there says he's going to hire 10,000 new employees. Now, where he's going to get them, I don't know. He's going to pay them, increase their pay. It's going to be, some of the nurses are saying, wait, that they're going to make more than I am. So he's going to have issues with that. But that's what Quebec's doing. What we decide to do in Ontario, I'm sure will be driven a lot by this report that's coming out. And I want to pay, we got issues here locally in Sarnia Lambton, but I want to give credit to where credit's due, both to the hospital that's helping with all these homes and managing, and I want to give credit to all the homes that have managed to do a good job and haven't been in the headlines, that are doing a good job, and to their staff, all of their staff, our EMS, that are doing the testing at these 2 assessment centers. We haven't got talking about that yet, but I know we will this evening before the program's over. So I'm sure at the end of the day, there's going to be a lot learned, and I look forward to participating in it as well.
You talked about testing, and indeed the Premier sort of started last Sunday when the Premier was saying, go out, get tested. And I know the health units and the local people had to adjust a little bit because the infrastructure wasn't in place, but within about 48 hours, ramp things up. Now, as we said earlier in the show, drive-through testing available in Sarnia and Petrolia as well. Sarnia is just literally show up as a drive-through facility. Petrolia is still by appointment, but I guess it shows everybody working together. The fact that sort of started with the Premier's announcement Sunday. I know everybody had to scramble a little bit, but here we are Friday, and it's all available.
Yeah. So I encourage people that for their own well-being and if their own to feel better about it, to make, if they've got loved ones at home that could be compromised, to go and get tested. And I think the only reason by appointment, they want to make sure there's not long lineups. where we've seen that in some other centers. So I would assume that you don't even have to get out of your car. They're like drive-through. So in Petrolia anyway, and I'm sure the one in Sarnia is going to be the same way. I haven't drove by it yet to see, but going by reports. But yeah, and I'd encourage people as well to go and make sure that they get the test if they feel they need it. And then it'll all help when we start getting people back to work. Want to see the economy picked up, see these local businesses that can reopen, and reopen with confidence.
Of course, stage one is what we're at, or phase one, depending how you look at it, when it comes to reopening. And I've got to think now, sort of weighing what we're seeing when it comes to numbers versus potentially going to stage two at some point. I've got to think behind the scenes, there are a lot of discussions to weigh those options.
Yes, and I know that the premier and the cabinet and the caucus. I was on a call earlier today, and that was the subject of a lot of the call. How do we move, and when are we able to move to stage two, which would be more openings, more like maybe sports, like baseball, soccer, those type of things. They're not there yet. I think certainly, I know my calls certainly were reduced once we opened landscaping and those type of things, dog groomers, golf. Boats are in the water now or are being launched. I see a lot of fishermen out in the river fishing. So, we're slowly moving towards that second stage. And I know most people can't wait to be able to move on to that second stage. And all of the businesses I know have put a number of safety protocols in place to protect their customers and their own staff as well from this COVID-19. I just wish we could get past this, and I don't know how long it's going to take, but we're going to have to. We've accomplished a lot. When I say we, I mean the people of Sarnia Lambton, all the employees in healthcare and EMS, first responders, in getting as far as we have. We can't jeopardize that now, and we can't jeopardize it across the province. We've seen breakouts in some of these other states when we watch the American news, and some other provinces. So I just want to encourage and applaud the people and the work that the people locally have done to get us to where we are.
Do you think there could be more and more of a challenge in the next little bit where there's sort of that groundswell where people are wondering, can you zone the province, for lack of a better term, where you say maybe this area of the province is at stage two, but this area of the province is at stage one? I know there's been people calling for that, but it's not hard to move around the province by vehicle or other transportation mode. Is that sort of a challenge to even looking at that approach?
Yeah, I think that's what the premier's afraid of. Like he said, if we were to say isolate Toronto, he said, and Kingston's wide open because it's a region that we've opened up. He said people are going to be on that 401 heading down to Kingston. He said we're going to overwhelm Kingston if you can't do certain things in Toronto, and same with the north and that. And so I support I understand, and I've had people send me emails, or probably some of your viewers watching right now, saying, why can't we have this regional approach where we could open up, here in Sarnia Lambton, southwestern Ontario? Right for now, I support what the premier is saying. I see it's a real dichotomy because we see what's going on in Michigan. They're opening some parts of Michigan there, but yet there's parts that aren't. I guess that's where we're sandwiched here between New York and the hotbed of COVID-19 in New York, and Michigan almost twice as many cases as we have here in Ontario. We're in a very dangerous situation here.
Shifting gears, a couple of funding announcements came out today for both Sarnia and Point Edward.
Yes, earlier this morning I was pleased to be able to speak to both Village Point Edward Mayor and also Mayor Bradley and talk about transit-related funding. In Point Edward's case, a significant amount of federal provincial money, a joint funding agreement with Point Edward for their path down there. So I know it's a project they've looked at for a long time. They put it in for the ISIP funding, and it was approved. And also the city, a major announcement from the province and the feds to do with transit improvements in the city that I know Mayor Bradley and council have been looking at and wanting to move forward. And I know some of the city and the other municipalities in Ontario, as well as Sarnia Lambton, are having issues. But there's projects they want to move ahead with that they'll need when we do come out of this. So I was pleased to be able to communicate with them and assure them that that funding was coming from the federal and federal and provincial governments.
Before we let you go, it's Friday, it's the weekend. We've bugged you a little bit before on these segments about your time in the kitchen, and we see you've been kicked back to the office. But I hear you cook a mean steak on the barbecue.
Yeah, I've been doing a little bit of that. It got me thinking now. Maybe I should run uptown before the store closes and get a steak. Yeah, I'm mostly steak and hamburgers. That's about my culinary limit.
What's your steak?
I'm not one of those chefs on TV that you see whipping up something from scratch. That's not me.
Now, how do you cook your steak? How far done is it?
I like it medium to medium rare. That's me. My wife likes hers a little better done than that, but I know how I like mine. So
I agree with your wife, though. I'm closer to the medium well side of things. So her and I will see eye to eye on that. Bob, we'll let you go. Enjoy your weekend, and we'll talk to you next week.
Yeah, thanks again, Terry, and to all your viewers at your TV. And stay healthy and stay safe, and let's stay in this together till we conquer COVID-19.
There's Sarnia Lambton MPP Bob Bailey. Stay tuned. You're watching Sarnia Lambton Daily on your TV. Welcome back to Sarnia Lambton Daily. Well, we know it has been a challenging time for many when it comes to employment situations, whether adjusting their current job or maybe being put on layoff or having to wonder what's going to happen moving forward. Well, Bruce Hein is with Express Employment Professionals in Sarnia and joins me now. And Bruce, what are you seeing when it comes to what are you hearing about the job market? And we'll talk about your company in particular in a moment, but overall, what are you seeing? What are you hearing locally?
Well, we're starting to hear in small trickles, if you will, that people are starting to bring people back from isolation into their employ, reassigning people, moving people from working from home, working back at their offices. We're hearing that the local economy is starting to talk about an uptick, which is a good sign. So that just means more people are going to be hopefully back to the gainfully employed situation.
Take me back to March 13th, that area when everything hit. What was it like for you and your team?
Well, it took us about 1 to 2 weeks before we started to really feel the effect. We went into isolation on the 23rd, so everybody was working remotely, and this is new for us, as many companies working remotely have found. We scrambled to make sure everybody had the tools to do their jobs remotely. So that was a big focus. But then through the month of April, we started to see quite a rapid decline in the need for our services and our people. So a good number of our clients have put things on hold, had basically taken their staff, their temporary staff or their contract staff, and put them on waivers, so to speak. And people were taking advantage hopefully of some of the government programs, but I don't believe that fully replaces the regular income that they would have earned. So yeah, the month of April has been pretty tough, and even the first half of May, and we're starting to see a bit of an uptick right now. So that's encouraging.
For some companies, did you find too where they kind of had to really be cautious and sort of tread lightly because they weren't really sure what was going to happen, and therefore in some cases the first thing they're going to look at is cut some of their costs?
Yeah, and typically our business is generally a very good indicator of the economy. So as the economy starts to decline, we're the first victims, if you will, contract workers. But we're also very often the first benefactors when things start to uptick, because often businesses don't feel confident in the economy yet to hire on their own. So they'll go to contract needs and look at, how is this sustainable? Is it sustainable, this business? So it's a bit of a roller coaster for us right now. And in the meantime, all we're doing is letting clients know that we have people. We have people sitting on the sidelines, ready and eager to go to work.
Are you hoping that as we turn the calendar on Monday to June 1st, it might sort of result in a little bit of a fresh start for everyone and sort of get a chance to renew maybe a little bit and once again evaluate where we are and hopefully move forward a little more?
Yeah, we're already seeing that, where people are bringing people who have been on the sidelines back. So that's encouraging. Talking to the various clients, they're saying we're hearing that things might start up again. They don't have definitive plans, but they're feeling a lot more positive than they were, say, a month or 2 months ago.
Are there certain skill sets that you find? And I know I'm asking you to look into the crystal ball a little bit if you've got one hidden in the office somewhere. But certain skill sets, certain things that will be really beneficial for job seekers and people looking for work moving forward.
We're actually seeing the demand for people, although it's not huge right now. It's all over the map. So it's anything from entry level labor, clerical, right up through the full gamut, where people are looking for bookkeepers, accounting, skilled trades. We've even had the odd request for temperature screeners. So as staff are coming on site, they want people that can actually screen people. So it's all over the map.
I guess that's the thing. It's a new world, and there's something that if someone had to come to you a year ago and said looking for a temperature screener, you probably would have looked at them a little bit strangely. But I guess agility for both workers and employers is probably going to be a huge thing over the next little while.
Yeah, flexibility. Being a little bit flexible and open to the new way, and frankly, we're still defining what that new way is.
One thing you're working on, as many community partners are in Sarnia Lambton, certainly is working with some of the nonprofit organizations, and you've launched your own drive to sort of tie everybody together here.
Yeah, June has historically been the last several years what we call Brand It Blue, and we would go around to the market to our clients and ask them to provide us donations. We'd give them bags to fill up of food. Historically, at the end of school is when, ironically, the Inn of the Good Shepherd, a lot of their stock is depleted. So because the kids are coming out of school and maybe don't have a healthy meal plan at home historically. So there's quite a drain at the inn. So this year, since we can't get around to visit our clients face to face and make these requests, we've decided to do it a little twist with our typical fall pay it forward, which we used to run in close to Christmas when people were out of work and needing a paycheck maybe for Christmas gifts. Very often our clients would hire people for 1 or 2 weeks just to sort of give them a paycheck and help them out. This year we've tweaked it a bit, and we're going to do it in June. Everybody that hires somebody in June for a June start, we're going to donate $1 an hour to the Inn of the Good Shepherd. So we hope it does twofold. It puts people that are not working into a job that gets them some opportunity to earn a paycheck, and secondly, does some benefit for the Inn of the Good Shepherd.
No, definitely, obviously important for everybody working together. Question I would have as we sort of determine, as you said, the new normals and the new way of doing things, could we see situations where companies may hire someone but to basically work virtually for that company?
Sure. In fact, very often the norm has been a good number of our temporary or contingent workers that go on a contract get hired on by the client. As a matter of fact, we call it the Wall of Fame in our office. Every time a customer takes one of our associates and hires them onto their payroll as one of their employees, we celebrate that. As much as we hate to lose the associate as part of our family, we welcome the fact that we've helped people in the community by moving people along in their career, and hopefully they're positively impacted their lives.
Well, certainly interesting times for everyone. And Bruce, we appreciate the update and all the best when it comes to the June and the drive with the Inn of the Good Shepherd as well. And thanks for joining us.
Thanks, Terry. Have a great day.
There's Bruce Hein of Express Employment Professionals joining us here in Sarnia. Stay tuned. You're watching Sarnia Lambton Daily on your TV. Recapping our top story tonight, Blue Water Health has relocated all of the remaining active COVID-19 patients at Vision Nursing Home to the hospital. 9 patients have been transported in total. That leaves no active cases at Vision, as the 16 staff who are still considered active with the virus are isolated off-site. The outbreak status will remain in place until there has not been a new positive test for 2 weeks. That's our show tonight. Thank you so much for joining us. Be sure to follow us on our Your TV Facebook page throughout the weekend for updates, and we will see you back here on Monday.